clearing the view, understanding cataracts, surgical solutions, and modern lens implants. Welcome back to Health Sphere. Our ability to see clearly is fundamental to our daily lives. And for many, that clarity can be diminished by a common age-related condition called cataracts. Cataracts cause a clouding of the eye's natural lens, leading to blurred or hazy vision. While it can significantly impact quality of life, the good news is that cataracts are highly treatable through surgery, with the clouded lens being replaced by a clear artificial one. Today, we'll delve into the world of cataracts, exploring their symptoms, the advanced surgical techniques used for their removal, and the exciting options available in modern lens implants. The cloudy window. Understanding cataract symptoms. Inside our eye, behind the iris and pupil, is the natural lens. In a healthy eye, this lens is clear, allowing light to pass through and focus on the retina at the back of the eye, creating a sharp image. A cataract occurs when the proteins within the lens break down and clump together, causing the lens to become cloudy or opaque. Imagine looking through a dusty or foggy window. That's similar to how vision can be affected by a cataract. Cataracts typically develop slowly over time, and the symptoms may not be noticeable in the very early stages. As the cataract progresses, the clouding becomes denser, and the symptoms become more apparent, impacting daily activities. The most common symptom of a cataract is blurred, cloudy, or dim vision. This is the hallmark symptom. Vision may appear hazy, foggy, or less sharp, as if looking through a film or veil. The degree of blurriness can vary depending on the size and location of the cataract. Other symptoms that can indicate the presence of cataracts include difficulty seeing at night. This is a frequent complaint, as cataracts can reduce the amount of light entering the eye and increase glare from headlights or streetlights. Increased sensitivity to light and glare. Bright lights, sunlight, or even indoor lighting can cause discomfort. Squinting, or a halo effect around lights. Seeing halos around lights. This is particularly noticeable at night and can make driving challenging. Fading or yellowing of colors. Colors may appear less vibrant, washed out, or have a yellowish or brownish tint. Frequent changes in eyeglass or contact lens prescription. As the cataract progresses and affects vision, the need for updated prescriptions may become more frequent. However, eventually, glasses or contacts will no longer fully correct the vision problems caused by the cataract. Double vision in a single eye. In some cases, particularly with certain types of cataracts, a person may see two images with just one eye open. The impact of these symptoms on daily life can vary. Difficulty reading small print, struggling to see road signs while driving, finding it hard to see faces clearly, or having trouble with hobbies like sewing or reading, can all be signs that a cataract is affecting your vision to a significant degree. Cataracts most commonly develop as a natural part of aging. It's often starting to form around age 40, although symptoms may not appear until age 60 or later. However, other factors can increase the risk of developing cataracts, including diabetes, smoking, prolonged exposure to sunlight without eye protection, certain medications, eye injuries, and a family history of cataracts. Restoring clarity, surgical removal of cataracts. Once a cataract progresses to the point where it significantly impacts vision and quality of life, the only effective treatment is surgical removal. Cataract surgery is one of the most common and successful surgical procedures performed worldwide. It involves removing the cloudy natural lens and replacing it with a clear artificial lens called an intraocular lens. The decision to have cataract surgery is typically made when the symptoms interfere with daily activities and can no longer be managed with updated eyeglasses or brighter lighting. The surgery is usually performed on one eye at a time, with the second eye treated a few weeks later if necessary. There are two primary surgical techniques for cataract removal. Phacoemulsification. This is the most widely used technique in developed countries. It involves making a very small incision in the cornea. A small ultrasonic probe is inserted through this incision. The probe emits ultrasound waves that break up the cloudy lens into tiny fragments. These fragments are then suctioned out of the eye. The back portion of the lens capsule is left intact to hold the new artificial lens implant. Phacoemulsification usually requires few or no stitches, leading to faster healing and recovery. Extracapsular cataract extraction. This technique is used less frequently, often for very dense or advanced cataracts or in cases where phacoemulsification is not suitable. ECCE involves making a larger incision in the cornea or sclera. Through this larger incision, the cloudy lens is removed in one piece or in larger segments. The lens capsule is also typically left in place to support the IOL. This technique requires more stitches and has a longer recovery time compared to phacoemulsification. A variation called manual small incision cataract surgery uses a smaller incision than traditional ECCE, but still involves removing the lens manually, and it is often used in developing countries due to its effectiveness and lower cost compared to phacoemulsification. Cataract surgery is typically performed on an outpatient basis, often under local anesthesia and light sedation. The procedure itself usually takes less than an hour. Recovery is generally quick, with many people experiencing improved vision within a few days, though full recovery may take several weeks. Postoperative care involves using eye drops to prevent infection and inflammation, and attending follow-up appointments with the eye surgeon. The replacement. Understanding intraocular lens implants. Once the cloudy natural lens is removed, a clear artificial intraocular lens is implanted in its place. Wells are made of biocompatible materials such as acrylic or silicone and are designed to remain in the eye permanently. The power of the IOL is carefully calculated before surgery based on measurements of the patients. I too provide the best possible vision after the cataract is removed. Significant advancements have been made in IOL technology, offering a variety of options to suit individual vision needs and lifestyle preferences. The choice of IOL is a crucial decision made in consultation with the eye surgeon. Types of IOLs include Monofocal IOLs. This is the most common type of IOL and is typically covered by insurance. A monofocal lens has a single focusing power, usually set to provide clear distance vision. With this type of IOL, most people will still need to wear eyeglasses for reading and other close-up tasks. Some individuals opt for monovision, where the IOL in one eye is set for distance vision and the IOL in the other eye is set for near vision, reducing the need for glasses for some activities, although this approach is not suitable for everyone. Multifocal IOLs. These lenses are designed to provide clear vision at multiple distances: near, intermediate, and far. They work similarly to bifocal or trifocal eyeglasses, with different zones or rings of power within the lens. The brain learns to adapt to these different focal zones to see clearly at various distances. Multifocal IOLs can significantly reduce or eliminate the need for eyeglasses after surgery. However, some people may experience halos or glare around lights, particularly at night, which usually improves over time as the brain adapts. Extended depth focus IOLs. These lenses provide a continuous range of clear vision, typically from distance to intermediate. They achieve this by creating a single elongated focal point rather than distinct focal zones like multifocal lenses. EDOF IOLs can provide excellent distance and intermediate vision, reducing the need for glasses for activities like computer work. Reading glasses may still be needed for very close-up tasks. They may cause fewer visual disturbances like halos compared to some multifocal IOLs. Accommodative IOLs. These lenses are designed to mimic the eye's natural ability to change focus for different distances. They work by moving or changing shape slightly within the eye in response to the eye's natural focusing muscles. Accommodative IOLs aim to provide a range of clear vision, potentially reducing dependence on glasses for both distance and near. Toric IOLs. These are specialized IOLs designed to correct astigmatism, a common refractive error caused by an irregularly shaped cornea. Astigmatism causes blurred or distorted vision at all distances. Toric IOLs have different powers and different meridians of the lens to compensate for the corneal irregularity, providing clearer vision without the need for astigmatism, correcting eyeglasses or contact lenses after surgery. Toric technology can be incorporated into monofocal, multifocal, and EDOFs, light-adjustable lenses. This is a newer type of IOL that allows for post-operative adjustment of the lens power using a special UV light. After the eye is healed from surgery, the ophthalmologist can fine-tune the lens power through a series of light treatments in the office to optimize vision and correct any residual refractive error, including astigmatism. This allows for a highly customized visual outcome. The choice of IOL depends on various factors, including the individual's vision needs and goals, lifestyle, profession, presence of astigmatism, and any other eye conditions. The eye surgeon will perform detailed measurements and discuss the pros and cons of each IOL option to help the patient make an informed decision. While monofocal IOLs are typically covered by insurance, premium IOLs that offer expanded vision correction may have an out-of-pocket cost. Conclusion: cataracts are a common and often age-related cause of vision loss, characterized by the clouding of the eye's natural lens. While the symptoms of blurred vision, glare, difficulty seeing at night can significantly impact daily life, the good news is that cataract surgery is a highly effective and safe procedure to restore clear vision. Modern cataract surgery, particularly phocoemulsification, is a minimally invasive technique with a quick recovery time. The ability to replace the clouded lens with a variety of advanced intraocular lens implants allows for customized vision correction, potentially reducing or eliminating the need for eyeglasses after surgery. If you are experiencing symptoms of cataracts, a comprehensive eye examination by an ophthalmologist can provide an accurate diagnosis and discuss the best treatment options for your individual needs. By understanding cataracts, their symptoms, and the available surgical and IOL options, you can take proactive steps to clear your view and regain the clarity of sight. Thank you for joining us on HealthSphere. Prioritize your eye health and consult with an eye care professional for any vision concerns. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor or eye care professional for diagnosis, treatment, and personalized recommendations regarding your health situation.